Today, we're diving into a huge update from YouTube that has a lot of people talking. Hey everyone, welcome back to your health channel. This could directly impact you and people under 18. YouTube has announced they're going to restrict the amount of health-related videos shown to people under the age of 18. You might be wondering, why are they doing this? And is it a good or bad thing? Don't worry, we're going to break it all down in today's video, so make sure to stick around. Alright, first let's talk about the basics. YouTube is introducing new restrictions on health-related content for users under 18. This includes everything from fitness advice and nutrition videos to mental health discussions and more serious medical topics. Now, YouTube isn't banning health content entirely. Instead, it's tweaking its recommendation algorithms so that these types of videos won't show up as frequently, especially if they contain certain sensitive topics like mental illness, weight loss, or treatments that could be risky for younger audiences. So, this change is less about removing content and more about controlling access. So, why is YouTube making this move? Well, there are a few big reasons. First, there's growing concern about the misinformation surrounding health content on the internet. Health is such a sensitive area, and not all advice given online is medically accurate or safe. Especially for younger viewers, who might not be able to distinguish between credible and non-credible sources, this is a big issue. A lot of health-related content, even if it's well-intentioned, can promote harmful behaviors. For instance, videos on extreme dieting, dangerous fitness challenges, or unproven treatments can have a long-lasting negative impact on young people's physical and mental well-being. Second, it's about protecting mental health. A lot of health videos touch on sensitive topics like anxiety, depression, or even self-harm. If young people are constantly exposed to these without proper context or guidance, it could potentially worsen their mental state rather than help them. YouTube wants to limit exposure to such content to create a safer experience for teens. Lastly, this move is part of a broader trend where platforms are being held more accountable for what they expose younger audiences to. Governments and health organizations have been pushing platforms like YouTube to take greater responsibility for the kind of content they promote to kids and teens. Alright, so now that we understand the why, let's look at the potential positives of this move. First of all, by restricting the amount of health-related content shown to teens, YouTube could be helping to reduce the spread of dangerous misinformation. Imagine a 13-year-old watching a video about an unproven diet plan and then trying it without understanding the risks. By limiting these types of videos, YouTube is playing a role in keeping younger viewers safe from bad advice. Second, this change could help protect mental health. We know that constantly being exposed to negative or heavy topics can be overwhelming, especially for teenagers. By making sure that sensitive content about mental health or physical appearance isn't over-promoted, YouTube is aiming to create a healthier online space. Teens won't be bombarded by videos about mental health challenges that might not be presented with the care or context they need. Another benefit is that YouTube is still letting teens access educational and reliable health content, but they'll have to look for it more deliberately. It won't be as easy to stumble upon extreme or potentially harmful videos. But of course, every change has its downsides, and YouTube's new health policy is no exception. One major downside is that it might make it harder for teens to find valuable, accurate health information. There are plenty of good creators and healthcare professionals on YouTube providing reliable advice. Restricting these videos might limit teens' access to helpful information that they could really benefit from. Think about a teenager trying to learn about mental health or how to manage their diet in a healthy way. If YouTube isn't showing them these videos, they might miss out on learning something important. Another issue is that YouTube's algorithm might not be perfect in determining what is helpful versus what is harmful. Sometimes, algorithms can accidentally flag good content. For example, a video on body positivity or mental health awareness could get caught in the restrictions, even though it's offering helpful support. And, let's face it, teens are smart. If they want to find certain content, they will. Restricting recommendations might only push them toward less moderated or even more extreme sources of information on other platforms. So, what does this mean for you, whether you're a teen, a parent, or someone who's just curious? For younger viewers, this means you'll have to be more intentional about the health content you search for. Be sure to look for trusted sources, like actual healthcare professionals or channels that cite real science. For parents, this change is a reminder to be involved in what your kids are consuming online. YouTube is taking steps to help protect young audiences, but it's still important to have conversations with your kids about where they're getting their information, especially when it comes to health. And for everyone else, this might mean seeing fewer health-related videos in your recommendations, especially if YouTube thinks you're under 18. If that's the case, don't worry. The information is still out there, it just won't be as aggressively pushed onto you. At the end of the day, YouTube's decision to restrict health content for younger users is all about balance. They're trying to protect teens from harmful misinformation and content that could negatively impact their mental health, while still keeping the door open for educational and helpful content. Is this a perfect solution? Probably not. But it's a step toward creating a safer, more thoughtful online space for younger audiences. So, what do you think? Is YouTube doing the right thing, or is this restriction going to cause more harm than good? Let me know your thoughts in the comments below. Thanks so much for watching. If you enjoyed this video, don't forget to like, subscribe, and hit that notification bell so you don't miss any future updates. See you in the next one. By the way, if you're looking for more trusted health information, check out the links in the description below for resources from actual health professionals. Stay safe, stay informed, and we'll see you next time.